Rapid City. Great start. Lemon. Great. Thanks so much for joining, everybody. We're just doing some quick fire, where you're located in South Dakota, what organization you represent. I had the top of the hour, so we'll let people continue to join, but I want to be cognizant of your time today. And I know an hour is a lot to give up in today's world. So I'm just so thankful that you're here. And why are you here? Because of these beautiful baby faces that you see. Count the Kicks is all about saving the babies and from preventable stillbirth. So this is why we do what we do. And this is why I'm so happy that you're here today to learn more. A couple of just quick messages. This is a huge thank you to the South Dakota Department of Health. We are partnering with them, so webinars like this can come to you, this education, this training. You can get the free materials, which we'll talk about here in a moment, but just a huge shout out to the South Dakota Department of Health. A couple quick housekeeping things. You're all automatically muted. This is being recorded and you will be sent after the webinar, the slide deck, you will be sent the recording and a couple other links that we'll talk about today. Feel free to ask questions as we go, just so you don't lose them. You can ask them in the Q&A or the chat and I'll look at them at the end and answer them. But yeah, I want to be cognizant of everybody's time. So we're going to jump right in. I'm going to turn my camera off for the majority of this so we can get going here. So let's start off and learn more about Count the Kicks and the impact it can have.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
I just love that. So I always like to start off with that video to kind of set the stage, really. And this is me. I'm the program director with Healthy Birthday, which is the nonprofit organization that created Count the Kicks, which is an evidence-based stillbirth prevention program, and we're going to learn all about it today. My contact information is on the screen. I'll put it in the chat at the end of this, but I love hearing from you. You are the boots on the ground. You are the reason why this is going to be so successful in your state. So I'm excited that you're giving me an hour of your time today. So what is Count the Kicks? Count the Kicks is an evidence-based stillbirth prevention program. It educates expectant parents on the importance of tracking fetal movement. And what I love most is it's empowering. It empowers expectant parents to speak up to their providers if there's a concern. Just to set the stage, so we're all on the same wavelength here, let's talk about truly what stillbirth is and how it's defined. Knowing your line of work, I think we all know this, but I just want to make sure. So there's miscarriage, which is usually defined as the loss of a baby before the 20th week of pregnancy. There's stillbirth, which is obviously what we're talking about today, which is the loss of a baby after 20 weeks of pregnancy. On average, we lose around 22,300 babies a year across the United States to stillbirth. That's about 65 babies a day. And infant mortality is the death of an infant before his or her first birthday. And on average, there's around 20,000 infants die every year in the US. So what I want to do is pull your eyes to that 20,000 and that 22,000. The fact that we're losing just as many babies, if not slightly higher, to stillbirth and to infant mortality is not to underscore the importance of talking about back to sleep and safe sleep and newborn basics and all that wonderful messaging that we do for SIDS prevention and things, but it's to highlight the fact that we need to be talking about stillbirth and stillbirth prevention just as much as we're talking about infant mortality, just as much as we're talking about the importance of placing your baby on its back and not smoking around baby and things like that. So that's what I want to do today. I want to give you the tools and resources to be able to talk to your parents about this, to feel comfortable talking about it, and then giving them the tools and resources to know what's normal for their baby and when to speak up. Taking that information, that 22,300 babies every year in the United States that die, if we break that out by race and ethnicity, and I'll show you on another screen, but people are different learners, so this is a visual graph of what that looks like by race. And as you can see, there are some huge disparities that we need to address, and we need to look at how can we address these disparities that exist, and what can we do, and what then in conjunction, what can you do? So you can see that Black expectant parents are 2 to 3 times more likely to experience a stillbirth over white women. Native Hawaiian or other Pacific Islanders are also 2 to 3 times more likely to experience a stillbirth. So we have some stark disparities that exist. So if we take that a little bit further and put it in a different format, we know that families are 6.5 times more likely to lose a baby to stillbirth than to SIDS. That's 1 in every 173 pregnancies will end in stillbirth. Again, those racial disparities persist and exist. Native Hawaiians or other Pacific Islanders, 1 in every 94 pregnancies. Black pregnancies, 1 in every 97. Indigenous, 1 in 128. Hispanic pregnancies, 1 in every 205. White pregnancies, 1 in every 211. And Asian pregnancies, 1 in every 254. So thinking through the demographics and the work and the populations you work with in South Dakota, we know that we can really make a difference here. And if we look at your information a little bit further in South Dakota specifically, we know that based on the most recent 5-year average, the stillbirth rate in South Dakota is 5.85 per 1,000 live births. So you can see in that graph there, you're that red line, and you've spiked up from 2018 to 2019. And then Iowa's that yellow line. We want to get you down to that gold yellow line or past that. And then the national average there is that teal line. So on average, you're losing around 69, 71 babies a year to stillbirth. If we implement and replicate the success we've had in Iowa, where we've had a 32% reduction in the number of stillbirths, we potentially could save 22 South Dakota babies every year with Count the Kicks. So this is why we need you. So let's take a moment to step back and really talk through why are there disparities in birth outcomes and what can we do? What is Count the Kicks doing? Thinking through what you can do to address these disparities in birth outcomes. So research identifies the following: systemic racism, or the way that society fosters racial discrimination through mutually reinforcing systems of housing, education, employment, earnings, healthcare, criminal justice, epigenetics, which we know explains how early experiences, both positive and negative, can have lifelong impacts. Changing how our genes release this information. Other reasons why these disparities exist: predisposition to certain conditions, access to healthcare, socioeconomic barriers, And research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So here are just a couple things that we're doing to reduce disparities in stillbirth. We're listening. We have an app in 16 languages because that's what we've been told. We need our app in certain languages. So as we go throughout this presentation today, what do you need? Because what we can do is we can find grants, we can work with the health department and say, here's what we're hearing. And we want to make sure that we're meeting your needs, that we're meeting the needs of your community. We have culturally appropriate educational materials. We have a health equity team that helps us create videos and printed educational materials and FAQs all in different languages. We're always looking for funding opportunities to reduce racial disparities that persist. We're an inclusive organization, 100% board and staff trained on anti-oppression and structural racism. And we're improving our programming based on lived experiences. We hold community conversations, focus groups. We do community outreach beyond the healthcare setting. We've done non-traditional work, things like beauty salons and libraries and all sorts of ways to connect within the community where we know people are getting information. Okay, so we know about the data behind stillbirth and how it's a lot more common than people think, but let's talk a little bit more about the research and evidence behind kick counting. I know this is always around some questions that I might receive. And so when I talk about how this is an evidence-based program, what I mean by that is that we have taken research and looked at all different sorts of research and created this evidence-based program, this Count the Kicks program. And it's really based off of this Norway study in particular. And what happened here was our founders, who are all 5 Central Iowa women, who all experienced stillbirth or infant loss in the early 2000s. They were connected through friends and pastors. And as they started meeting and realizing that, you know, this happens a lot more often than people think, they wanted to do something about it. They went to a public health conference and they heard some researchers out of Norway talk about a study that was done that showed when women were educated at 28 weeks on the importance of tracking fetal movement in the 3rd trimester, they were handed a pamphlet. When they were educated among this cohort of women, the stillbirth rate decreased around 30% in this cohort. And so our founders, these women hearing this from Iowa said, wow, that's amazing, like all on education and having the tools and resources. Let's do that. We can bring this to Iowa. We can create an empowering evidence-based program that does this in Iowa. And that's exactly what they did. They looked at other research, they came back to Iowa, they worked with Iowa Department of Public Health, and they created Count the Kicks back in 2008. And we've just been on an upward swing since then. And so we've had a 32% reduction in the number of stillbirths here in Iowa. And I'll talk a little bit more about that data and how we implemented that and what we need you to do to implement that success in South Dakota. So if you're really into research and reading journals and things like that, we have a whole evidence page dedicated to this on our website. But this is the Norway study. Dr. Ruth Fretz, who is the only United States researcher on this, is now part of our medical advisory board. So I always like to highlight the Norway study. And then most recently and most exciting, you guys are one of the first individuals to know we recently had research published in BJOG, which is the International Journal of Obstetrics and Gynecology, where we had researchers really look at the implementation of Count the Kicks in Iowa compared to surrounding states. South Dakota was not included in this, but Minnesota, Missouri, and Illinois were, who did not have Count the Kicks, to really see that increase of materials going out the door, app downloads, and looked at the decrease in stillbirth rate and found that we had a 1% decrease every 3 months in the stillbirth rate because of the inception of Count the Kicks. So we have this wonderful short video that really highlights that I want to share. And so let's watch this.
We know that there was no other sort of public health campaign going on in Iowa related to stillbirth at the time. And we know there's a relationship between the activity of Count the Kicks and the changes in stillbirth rate.
Prominent stillbirth researcher Dr. Alexander Hiesel led the study that shows birth outcomes improved when moms learned about Count the Kicks.
And I think there was no doubt from the data that we saw a massive jump in the app downloads when there was a TV appearance. And I mean, I think ultimately as human beings, we are hardwired to listen to stories. You know, you can hear people like me talk about data all day long, and after a while people's eyes kind of glaze over and you can see that you've lost them. If you combine that with a story from a mum who kind of, you know, as you said, narrated how her experience identifying that her baby wasn't well because it wasn't moving normally, and then someone listened to her, took it seriously, did the tests that were needed, the test showed that there was a problem and the baby needed delivering, then that people listen to that and it touches them somewhere that numbers just don't.
Research shows that in Iowa, when more moms used the Count the Kicks app, more lives were saved.
Count the Kicks has had such an impact in helping mothers believe in themselves and believe in that they know what's happening within their own bodies, and then their ability to talk to a doctor in a way that they'll listen to, that the mom does know what she's talking about, because it gives them the tools to be able to show to the doctor when there's been a change in those kicks.
The Count the Kicks app is a data download for your intuition. Paying attention to your baby's movements is a great way to monitor your baby's health in the 3rd trimester. Download the free Count the Kicks app and get counting today.
We know.
So looking on a graph versus video, which you can access those videos on our YouTube channel, and any of those stories are great to share. But if you're more of a graph person, this is what the data looks like. In 2008, when we launched, we were at one of the highest stillbirth rates, and we've seen that 32% reduction, and we're continuing to see that downward trend. Of course, there's some outliers years like that, things like a syphilis outbreak, a pandemic can impact the stillbirth rate, but we really want to focus on that downward trend. We also saw about a 39% reduction in the number of stillbirths among African-American women in the first 5 years of the program. So this is what we want to bring to your state. And that's exactly what we're doing with the South Dakota Department of Health. And we're so excited. So how do you get these materials that has led to a 32% reduction? You can access all of these free materials on our website right now. One of my favorite parts of the presentation is where we take just a 2-minute break. You go, you scan this QR code, or I'll put it in the chat, the web link. I want you to go, I want you to click on order materials, and I want you to order right now. You have the time, you're sitting there hopefully at your computer. I play a couple minutes of this fun song, and then I want you to come back and we're going to talk about how to utilize these resources that you just ordered. Comes in posters, app reminder cards, brochures, and it's all free. So let's take a moment. I want you to go to this website that I'm putting in the chat right now, or you can scan the QR code. You'll also be entered to win an Amazon gift card. Go and fill your shopping cart and order, and come right back.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine.
All right, we'll circle back to this too, but I wanted to give you just a couple of moments because I know things get busy after these types of webinars. So I always like to do that. So let's continue talking about the research behind this. And I think some of the top questions you might have are, what are the side effects? There are no adverse side effects. There's no increase in hospital utilization. There's no increase in anxiety among pregnant people. And so here's some research studies again on our research evidence slide or web link. But this research that I pulled out says usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits, because now you have a highly educated individual that has, especially if they're using the app, data in their hands to understand what's normal for their baby. We also know that decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. There's worse outcomes in pregnancies with reduced fetal movements, and with one study demonstrating the highest incident of poor outcomes in small for gestational age fetuses. The anxiety, I think that's a number one question that I get. And we have done our own study with the Des Moines University and the Harkin Institute here with our thousands of app users, and found that 84% of app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. And there's other benefits I don't think we always think about, things like reduction of preterm birth rate, because remember, this is a check on baby, right? Fetal growth restrictions could be identified earlier. We also know that women who have stillbirths are substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. So I really like this quote from the research study that says, due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. Looking back at that connection between stillbirth and maternal mortality and morbidity, last April, we pushed out a white paper that really highlighted that connection and really talked about why there is such a connection between the two, and included firsthand accounts from American women who were using the app and knew to speak up, when to speak up, and saved not only their baby's life, but their life as well. So I think there's other ways that we can connect the dots here that we can be thinking of. Not only are we impacting the baby, but also the expectant parent's life as well. Okay, so how do you implement this? Why is this important? You know about the data, you know about the research, you have all of that in your toolbox, but why do movements matter so much? Movement is one very important way a baby communicates before birth. And we know, and research shows, a change in a baby's movements can be an early sign, and sometimes it's the only warning sign that baby may give when in distress. So when do I want you to start doing this with your expectant parents? And ACOG recommends beginning counting at 28 weeks. ACOG is the Academy of Obstetric Gynecology. So right at the beginning of that third trimester, 28 weeks, you want to start having this conversation with your families, with your expectant parents, with your WIC clients and patients, with your home visitors, your Bright Start families, right around the third trimester. If you know that they are high risk and they've told you that, or you're their provider or nurse, go ahead and start having this conversation at 26 weeks. This is really when research indicates baby has established that pattern, that consistent pattern that we can feel and track. So when you're talking about Count the Kicks, obviously we're called Count the Kicks, but it's more than just a kick, right? It's all those different movements. It's the rolls, it's the jabs, it's the swishes, it's the pushes, anything except hiccups. Hiccups are involuntary, so they do not count. So when you're talking to your parents, especially those first-time parents, when they're like, well, what does that mean? What sort of movement? You can explain to them kind of those, they jabbed your rib. If they ask you what a hiccup is and how to decipher what's a hiccup in a movement, you can explain how hiccups are very rhythmic, right? Like they're very rhythmic bumps in your tummy. You can usually sometimes even see them and feel them, are like little pops back and forth, that type of thing. So this is how you do it. This is how you talk to your parents about Count the Kicks. So starting at the third trimester, you want to say, come on, we want to start counting. What do you know about your baby's movements? Let's talk about this. There's a free app that you can download. You can use our paper kit counting chart. So have them download the app right there in front of you. Have them pull out your phone. You're going to have it on your phone here in a minute when we talk about it, and to say, I want you to count your baby's movements every single day, preferably around the same time. Because what's going to happen is you're going to start to see a trend. You're going to time how long it takes your baby to get to 10 movements. And what the app does is it gives you a very good visual representation of what the pattern is for your baby. You're going to see that after just a couple days of using this app. I want you to continue tracking every single day, and I want you to call your provider no matter what time of day it is if something has changed. If you notice a change in how long it takes your baby to get to 10 movements. I know South Dakota has some very rural areas, much like Iowa. So when we're thinking about this and integrating this as you think through this for the next 30 minutes, think about how if you have a location and you have a birthing center that's 45 an hour away, make sure your parents know, like if you have any questions or concerns, don't wait for your family practice to open the next day. Go to your nearest birthing center. When in doubt, get checked out. So what is our hallmark tool? It's our kick counting app. So let's watch how it works, and then I'm going to talk you through it.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So my second favorite part of the presentation is when I ask you to pull out your phones. If you're not on it, if you have the ability, can you pull out your phone and go into your app store, search Count the Kicks, and you'll see that little yellow clock icon and download it. It's completely free. It's in 16 languages. This is linked here. You'll get this PDF, but the languages, if you have a question, if it comes in a certain language, you can go ahead and put that in the chat. But I can just tell you it comes in Amharic, Arabic, Burmese, Chinese, Dari, English, French, Haitian Creole, Hebrew, Hindi, Marshallese, Portuguese, Russian, Spanish, Swahili, and Vietnamese. It's completely free. So how it works is just what you saw in that video, right? In the 3rd trimester, around the same time each day, pick a time. Maybe it's a time right before dinner. Or right after all your other kiddos go to bed, and you can sit down and you can lay down and focus on baby. You could say to an older sibling, like, come on, let's count baby brother's kicks and things like that. So they pick that time, they tap that footprint as soon as they want to start with that first movement that they feel. They tap that footprint every single time they feel the baby move. After they get to 10 movements, they are asked to rate the strength of those movements. What research shows is not only should we be paying attention to how long it takes baby to get to 10 movements, but the strength of those movements. If you think back to baby Ruby's video that I shared earlier, where her mom says her movements just felt softer, they felt weaker. That's the strength, right? Like we want to be paying attention to that too. So after you rate the strength, you can also add additional notes, just kind of like a mini diary that you can keep track of. And then what the app does is it gives you that visual graph, right? You can see the line graph there. You can see the movement strength with the little feet. It's a very visual. It should be pretty linear, right? With the line graph, a couple of dips here and there, but for the most part, it's pretty linear. So if one day I was counting and it usually takes, I don't know, 15 minutes to get to 10 movements, 15, 20 minutes to get to 10 movements. And one day I'm counting and it takes an hour and 15 minutes. What happens to that graph is it changes. It would spike way up. And that would indicate to me as the user to say, huh, That's not my baby's normal, right? My baby's normal is usually 15 or 20 minutes. That's what it's been for the last 3 weeks that I've been counting around this time. I'm going to call my provider and work with my care team to see what they want me to do. So you can restart a session, you can delete a kick, you can set daily reminders. This is emphasized here because I really, really want you to encourage your expectant parents to go into the app, and you can just do it right there in the app to set a daily reminder. I can't stress enough how important this is to do this daily around the same time each day, because that's how they're going to understand the pattern and trend. Also, what's really great and important is you can review kick counting history. They can download their history and share it with their provider. They can upload it to a MyChart. They can take it to their next WIC appointment. They can share it with friends and family. Your friends and family can get connected. Maybe you want a grandparent to also connect to the device, right? And they see how baby's moving, or a significant other. You can count on Apple Watch too. So I could be in bed laying there, my phone's already charging across the room, but I have my watch on and I get that little notification that says, hey, it's time to count your little kicker. And I can just do it on my watch and it automatically syncs. And then I have really exciting news for you all today. You're like the first state to know. We just launched a web-based kick counter. So you can also count on the PC. So not only could you count one day on your mobile phone, the next day on your laptop, and then the third day on your watch, and it's all interconnected. Or this is a great resource for those that maybe always have, Wi-Fi issues and they don't have a mobile device that's very accessible. Could they go to a library and count, or a friend's house, or count during a 10 or 15-minute break at work? There's just a lot. It's just another way that we're trying to be inclusive and reach everybody and give everybody tools and resources to count. Another thing on our app that I really wanted to highlight is the fact that we have this find local resources. So in the resources section of the app, you can click on find resources and you can enter your zip code and find free or reduced cost resources located near you. So if you have somebody that's trying to find food banks or childcare assistance and things like that, if we can impact people prenatally before a baby gets here, the chance of that baby experiencing adverse childhood experiences decreases significantly. So this is just another great tool that we wanted to offer all of our app users. So feel free to take a look at that. If you are a free resource or low cost resource, you can claim your own program on this website. You just go to the lower right-hand corner, click on claim program and fill it out, and then people can find you. So I want you to download the app. I want you to order materials all in this hour that I have you, because then you don't have to think about it. And then you have all the tools and resources at your fingertips. Okay, so how do you implement this? You have the app, you're ready to go. You know that you want to start talking about this at 28 weeks, but how does it work in WIC? How does it work with home visitors? How does it work with a nurse or an OB? Let's talk about that. But first, let's highlight the fact that when you're doing this, you're improving health literacy of your parents. Health literacy is one of the strongest indicators of an individual's health status. So how do you improve health literacy with having this conversation? I'll tell you. You're being equitable, you're avoiding assumptions, and you're providing this information with all of your expectant parents, no matter their race, their gender, their religion, sexual orientation, status, educational level. It's the same information and interaction every single time. You're listening and you're learning. You're asking strategic and open-ended questions. You're asking questions like, have you ever heard about kick counting? What do you know about counting your baby's movements? Let's talk about this. So you're assessing their individual needs and understanding and their feels and desires. You're being clear and concise. You're avoiding long or complex explanations and medical terminology. So I have used the word fetal movement a lot and stillbirth a lot. You're going to not say things like fetal movement. You're going to say baby movement and baby kicks and things like that. But you're also being honest. You're speaking the truth while always practicing empathy and compassion. Stillbirth is something we need to talk about, and we should be talking about it with every expectant parent. And then you're reteaching. This is really important. Even if you feel like the patient understands, I want you to talk about this every single time you see them. You're being, you might need to clarify, you're providing that extra support, and it just encourages them to trust you and know that you're a credible resource to say, yeah, I want to tell you about my baby's movements. Of course I do. I want to talk about my baby. Some other common misconceptions that I wanted to highlight before we go into, like, depending on your role within your organization of how you could talk about this, but just so you're aware, because one, maybe you're thinking some of these, or maybe you'll get these as you start having these conversations. So I want you to be prepared. This is probably the number one question I get, or the comment I get when I'm talking to a parent about this. I do a lot of virtual baby showers, or, in-person baby events, and I get it. I have had 3 pregnancies, and my 2 boys, they were active. It was like a jungle gym in there. So when I tell my friends about this, they're like, I don't need to count kicks. It's always, baby's always moving. I can't get a moment's peace. I get it. But I always say the same thing. I say, that's awesome. A healthy baby is an active baby, but even active babies can experience distress, and sometimes it's quickly and without other warning signs. So really tracking your baby's movements daily takes that guesswork out of knowing if a normally active baby has slowed down. Plus, Count the Kicks gives you real data to show your healthcare provider if you have a concern. I really like it because we're such busy individuals, and I feel like we go at the speed of lightning sometimes. So it's hard to remember, did they get 10 movements in 5 minutes, or was it 20 minutes? I can't remember because I wasn't focused. So it really takes the guesswork out of knowing that. Only those experiencing a high-risk pregnancy should pay attention to their baby's movements. We've kind of already talked about this, but I want you, no matter what, high risk or not, all expectant parents deserve and should be educated on Count the Kicks and getting to know what's normal for their baby. That's really key, right? It's what's normal for my baby, not my friend Sarah's baby, not my previous pregnancy with my son. It's normal for what my baby is happening right now. Ooh, a good one. 10 kicks in 2 hours. I guarantee you have heard this, or you've heard you should get 10 kicks in 1 hour. Every baby's different, and the recommendation to expect 10 kicks in 2 hours is outdated. Current research indicates moms should get to know and understand the normal amount of time each day it takes their baby to get to 10 movements. And I'll tell you why. There's a research study on our website, but basically what it says is, as humans, as individuals, we focus so much on the time. I know I have you for 60 minutes. This is an hour-long lunch and learn, essentially. And so I'm focused on that. I'm focused that I have you for about 25 more minutes. And so when we tell somebody 10 and 2, we're so focused on that 2 hours. So I could be counting every single day for the last 3 weeks and get 15 minutes, 10 movements in 15 minutes. And one day I count. And it takes an hour and 47 minutes. And I think, that's okay though, because I still got 10 movements in 2 hours. So I'm totally fine. But that's not my baby's normal, right? My baby's normal for the last 3 weeks has been 15 minutes. And so I want to get to know what's normal for my baby. So if that changes, I can contact my provider. What about a Doppler device? That's a popular thing too, right? You can download apps. A change of a baby's heartbeat is the last thing, one of the last things to occur when a baby's in distress. I think that always surprises people. A change in a baby's movement may indicate potential problems before the actual changes in the heart rate are detected. Same when you go in with a change in fetal movement to your provider, they don't just set you up with a Doppler and check baby's heartbeat. They do additional testing, and that's why they want to see how baby's moving too. They want to look at baby on ultrasound. They want to look at mom, that type of thing. So we really don't want to do Dopplers and device unless they're, educated on using those. Here's another common one. If baby's not moving, I should drink something cold, eat something sugary. I've heard things like drink Mountain Dew, do jumping jacks, right? Eat a Snickers bar. Again, research has moved away from the idea that sugary drinks and the like are a good way to get baby to move. We know, and research shows, that kick counts are best monitored without interventions like juice and candy. Because again, if baby's not moving like normal, parents should speak up. Why are we trying to force baby to move if they're not moving like normal? It's just like when you and I are sick. When we're sick, we rest. We sit on the couch, maybe we watch that terrible daytime TV, we're sleeping, we're conserving our energy. Same with baby in utero. If baby's not moving like normal because of infection or low amniotic fluid, or they're tangled in their umbilical cord, whatever the reason, their movements are changing, and we need to pay attention to that. Babies kick less near the end of pregnancy. You'll get this a lot. I think back to my grandma when I was pregnant, and she's like, "Oh, you're about to pop. You must be running out of room, right?" And of course, I had like 3 months left. I was with my third, and that's always feels great. But babies don't run out of room, right? The types of movements may change. You might get more of those jabs in the rib or your bladder, and less of those, body rolls. But again, babies are moving up to and during and even during labor. If you're paying attention and monitoring your baby's movements at the same time or around the same time each day, it's still going to take around the same amount of time to feel those 10 movements. What about dental care? This is a common question. I think you'll get it a lot from your parents of like, I really should not go to the dentist, right? I just want you to stress the fact if you're talking to them, especially, in WIC and home visitors and making sure you're just having that conversation, that good dental health care is always important. We have a lot of great programming around this in Iowa that we've been piloting, and just the data that we have of people not going to the dentist. I mean, I get it. I don't like going to the dentist, but there's so much that goes on during pregnancy. And so we really want to encourage people to continue going to the dentist during their pregnancy. Triage doesn't need any Count the Kicks information. This is the perfect place to have information. This is the perfect place to have posters and brochures. We'll talk about some discharge paperwork. If I have any labor and delivery nurses on the call today, please share this within your clinic and your health system. If I have anybody that works or knows labor and delivery contacts, share this with them. I went to triage 3 times with my daughter because of movement. I did not know at the time. I didn't have the app. It was before the app came on in 2015. I was just comparing her to my previous pregnancy where my son moved all the time, 5 minutes or less, I'd get 10 movements. I knew I should be counting, but I didn't understand I should be understanding what was normal for her. So every time I counted, it took her a good 30 minutes to get to 10 movements, even when I was focused on her and everything. And that just made me nervous because I was like, well, my son never did that. So I went to triage several times, got checked out. Everything was great. She's now a 7, feisty little girl. But I didn't know, right? Like, how great would it have been at triage to say, yep, everything's great. Here's how you track your baby's movements. Here's a brochure. Here's, here's the paperwork that you can use when you're after visit summary. So we have all those resources. So thinking through systems change and thinking through your current workflow, whether you're WIC, you're a home visitor, whatever you do, here are some things that you can easily implement. And I'm more than happy to spend more time on this, to have a call with you, to set up some things, to send you some messaging. So if you're in the clinical setting or even WIC, can you add information to paperwork, whether it's discharge paperwork, your team care plans, your calendar to know, okay, mom is 24 weeks pregnant. I'm going to see her again in a couple weeks. So I'm going to make a note on my calendar to make sure I talk to her about this, or I'm going to make a note on my team's calendar so Megan can talk to her about this. Can you make sure all of your team is educated on this? This is being recorded and you will all get sent the link to the recording. Share it. Make sure everybody knows about this. You can include this in a family care intake form. What if you have a family and mom's pregnant and it's 20 or 21 weeks and you're not going to see them again until about 32 weeks? Go ahead and tell them about this. Hand them the brochure and say, hey, I don't know if you've ever heard about Count the Kicks or the importance of tracking your baby's movement, but I want you to look at this. And then I want you to put right now in your phone a note to start tracking when you hit the 3rd trimester, which would be in, 8, 7 weeks, whatever it is. Have that conversation with them. I know a lot of times I do this a lot with WIC where they're like, well, I might see them and then I might not see them for 4 weeks, or I might not see them, but my colleague will see them. How can you integrate this so it's in a chart, it's in a document? You can absolutely share this information with somebody earlier than the 3rd trimester if you're not going to see them. Just make sure you're clear and that you say, I want you to start doing this. I want you to talk to your provider about this in the 3rd trimester. If I have clinical staff on here, in Iowa, we always have to do the glucose test in front of the nurse, and then you have to sit there for an hour, and then you do your blood work and you go back to your appointment. how great would it be to say, hey, read this brochure and download the app while you're waiting, and then we'll talk about it when you come back. Same thing if they're waiting in another clinic or WIC or home visitor or libraries, you know, like here's an app, here's the brochure, go ahead and read this, and then let's talk about it. For clients using a data plan, how much data usage might be normal to use the app? That's a great question, Tia. I don't actually know. I will find out though and see what the data is. I mean, it's completely free, so I'm not sure how that works. As long as they're connected on Wi-Fi, it should be okay. But let me get back to you because I'm not sure I know enough technicalities for that. EMR, EHRs, we'll talk about that here in a minute. Could you add Count the Kicks information to a phone recording, that type of thing? Here's an example of our gold standard after visit summary. So this is just a normal, they came in, they have an after visit summary report, and we added Count the Kicks information. We have health systems all over the United States doing this. Feel free to reach out to me of how you can get this information. This language could also be included in any of your family care plans, intake forms, that type of thing as well. And then we have a QR code to download the app. This is another example from Celebrate One in Ohio, where they serve about 2,000 expectant parents in this like one-stop shop. So they don't get to see them again, but they're usually within like the second or third trimester when they see them. So they really wanted to make sure that they at least talked about this on the form when they were tracking people. And so we came up with a script for them and they handed out the brochure. So there wasn't any follow-up, but at least they were getting the information. So a lot of great ways that you could do this. So some additional resources other than the brochures and materials that you already ordered, you can take an online CE training. It's $40. You just scan the QR code. I'll put it in the email that goes out as well. It goes into a lot more detail. It has a whole equity and inclusion slide too, or section module. It talks about the research a little bit more. You get to read the Norway study. So yeah, you can have access to this as well. So next steps, what I want you to do is obviously become familiar with the app. You've already downloaded it, I hope. You've already ordered materials. I hope I get off this call and I see my inbox full because we get those notifications. So take advantage of that. This is in partnership with the South Dakota Department of Health. And so it's because of this amazing partnership, you get all of these print materials for free. You can put them up in your patient rooms, your restrooms, your waiting rooms, take them with you in your car. If you drive around, remember you're the boots on the ground. Do you have coalition meetings? Can you share it with them? Maybe designate somebody to always oversee the order of materials and make sure that they are there. Make sure you take time to educate. Having that kit counting conversation every single time you see them is really key, because I think we've all heard, you know, what it takes 8 times to form a habit or something like that. Always talk to them about this. Making sure everybody on your team knows about it, debunking those misconceptions, and encourage speaking up. If you're working with a parent and they say, oh, my provider's never talked about this, like, I don't know, go ahead and talk to them about this. Like, tell your provider that you're doing this and you want them to know. We want to educate providers too, right? And then remember, hours and minutes matter in preventing stillbirth. We want to educate patients and staff on how to expedite concerns about movement. If somebody calls with reduced fetal movement, they should not be told to leave a voicemail. They should not be told to call back later, or a nurse will call them later. They should be told to come in immediately and we'll get checked out. Or encouraging your parents to say, if you feel like something's off, just like if they were bleeding or having contractions, you would want them to go in right away, because time is of the essence. And a lot of times, right, 9 times out of 10, everything's fine, but we want to make sure that everything is fine. So let's ensure that our parents know the importance of tracking fetal movement and know how to speak up, calling their provider if it's after hours, or going to their nearest birthing center. They're open 24/7, and that's what they're there for. So why do we do this again? We do this so more babies like Nala can be here earthside. So let's hear more about Nala's story.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself, don't feel bad or stupid, don't worry about insurance or the emergency room bill, go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously, like, it's your baby's life.
So we have stories like that from all across the United States and even internationally. Our app has been downloaded hundreds of thousands of times. We've had 3 million pieces of materials go out the door. It's in, our app is in 140 countries. And we get these stories where parents just contact us and say, hey, I was using your app and I noticed reduced fetal movement. I went into my provider and baby's here because of it. So we know there's countless more out there. This is what we want to see happen in South Dakota. I am happy that you all took time out of your busy schedules today. We still have about 5 to 10 minutes left. I'm happy to answer any questions. I just got notified that we've had over 30 orders, so y'all rock. It's probably our highest webinar, so feel free to go order the materials at any time. It doesn't have to be just now. We just did that because you're right here and there, but you can order throughout the year because of this partnership. Follow us on social media. You can reshare things with your parents. You can share YouTube videos with your parents. We have a parent academy that you can access on our website. We have a lot of digital tools. So I'm going to answer some questions. Let's see. The data plan, Tia, let me get back to you on that. For those who do not want to download an app, is there a handout available informing them? Yes, so I would definitely order the materials first, the brochures and things like that, because it just talks to them about why it's important and things like that. And then we also have paper kick counting charts available on our website too, that you can download. And I'll make sure to put that in the link, the direct link to it's in English, Spanish, Haitian Creole, Portuguese, I think, these kick counting charts. So if they don't want to download the app, they can absolutely do pen and paper. I had downloaded the app a few years ago to show my clients, well, I need to re-download the new app to get the new features, or an update will absolutely do that, Brenda. So that's one thing I didn't mention earlier too. So I use the app with my 2018 pregnancy. If I were to get pregnant again, I just log in and I could set up a new pregnancy profile. And then I could access all my old data, but you don't have to set up a new account each time. You just can go log in, reset your password if you don't remember it, update the app. The new features, you're right, Brenda, the strength feature and stuff like that would be on the updated version. So you'd want to do that. So I'm going to find out about data. I'm going to send you all paper charts as well on our website. What other questions do you guys have? Does this all make sense? Do you plan to have more languages in the future? Yeah, that's a great question. And we usually base it off of what we hear from you all in the community. So I did a presentation not too long ago, and I've heard a couple of other states like Ohio and Indiana, they wanted the material in Somali. And so that's something that we'll look into. We'll either work with our partners in that state or we'll look for grant funding for that. It's not crazy expensive. So I think it is something that we could talk to the South Dakota Department of Health or look at other funding partners to do. Do you have a language in mind that you would need? This is really good for me. Okay. All right. That's good. That's important. I'll write that down. Thank you. Would you like print material and the app, or one or the other? What would make sense for you? Both or one or the other? So like in Arizona, we have print material in Navajo. The app is not, but we have the print material in Navajo that we've done. So that's an option too. But yeah, you guys are Russian. I think we do have it in Russian. Oh, and print material. Ukrainian language as well. You know, that's probably the second one that asked me about that. Print material, okay. This is great. And my wonderful friend and partner is on from the health department today. So I know she's seen all of this too. I think we'll start to see, yeah, we did Dari not too long ago because of an influx of refugees coming from Afghanistan. So we'll definitely look into the Ukrainian, at least on the app, and then we'll discuss print too. But this is really, really important feedback for us. And remember to order what we do have. We do have it in English and Spanish. Yeah, there's Amy. Hi, Amy. Amy's my wonderful colleague in this at South Dakota Department of Health. And so, yeah, I'm happy to be here today. And I'll put my contact information in the chat again. And I don't know, Amy, if you want to put your contact information too in the chat. You guys can email either one of us. And like I said, either later today or tomorrow, you'll get the recording, you'll get the PDF slide deck, you'll get a couple other links that we talked about. So you'll have all this at your fingertips. So I'll stay on for a couple more minutes, but if you don't have any more questions, feel free to get 5 minutes back of your hour, which is amazing. I think we could all use that. And enjoy the rest of your day. I hope the snow melts for y'all that are having snow issues. Thank you so much for all that you do and for implementing this in your state. Thank you to the South Dakota Department of Health. This is huge and we're so excited to be there. Thank you. Thanks, everyone. Thanks, Tia. I'll connect with you, Tia. Thank you. I'm going to hit stop recording so I'm not just standing here.